Hey, this is Russ. Sorry for the lateness of this video. It didn't come out at 7 a.m. I know some of you wait 4 to 7 a.m. morning time and immediately watch the videos. Yeah, I know this. I can see it on the statistics. But yeah, once again, I forgot to do it. And so here it is just before 7 a.m. on Friday morning. And so I figured I better do this video. So let me tell you something about my knee. Now, in a couple of weeks, I will have finished 2 full years since my knee replacement. Yeah, almost a 2-year anniversary. So you would tend to think the knee would be perfectly fine by now, right? Yeah, no, it's not. I still have pain at the incision. Yeah, incision pain. Now, I'm not talking about zingers. We've talked before about zingers. Zingers is like when you're like laying down and you're about ready to go to sleep, and then whoa, you can feel that little zip of pain in the knee, right? It's almost like an electrical pain. So I'm not talking about that. This is a whole different type of incision pain. This incision pain kind of feels like it's about ready to rip open. Yeah. I would tend to think after 2 years, you wouldn't feel that, because for the majority of the time, I don't know how long, let's say a year after the operation, okay, I didn't feel a whole lot of pain from the incision. I would get the occasional zinger here and there, but no actual pain. This time, I'm actually feeling like a little bit of pain, almost like the incision's going to rip open. Why is that? I don't get it. I keep thinking, by now, most everything should be done and over with. Okay. And for the most part, it is. But this pain has just started resurfacing again, right at the incision. I mean, I'm not talking the whole overall knee is painful or anything like that. I'm rubbing my knee right now. I'm talking right at the actual incision. I can feel... it's more than a stinging. I don't even know how to even describe it. Do you guys have that? Let me know in the comments if you have that. I'm not talking zingers, okay? I'm not talking the occasional you're walking around or sitting there doing nothing and then all of a sudden you kind of feel a little zap, okay? I'm talking about actual pain in the incision. And I'm not talking heavy-duty pain. It's just... I don't know, it's bothersome, okay? And typically, I don't call that pain. For me, because I do kind of have a fairly high tolerance for pain. I mean, even if I feel pain, I just say, okay, it's hurting, okay? But I don't really like, oh, it's killing me. I don't do that, right? So I don't even really want to call it a pain, but I know it's there because I can feel it. It actually feels like it's going to rip open. That's what it feels like. Okay, and obviously it's not going to. It's been closed up for almost 2 years now, so that's not going to happen. But it kind of feels that way. So short but sweet. But I just wanted to bring it up just to see if there's anybody else out there that has that kind of pain that it feels like the incision is going to rip open on you. Okay. Oh, by the way, in terms of incisions, I know that there's incisions that are closed up with staples. Some incisions are closed up with the super glue type of stuff, right? Cyanoacrylic stuff. That's super glue. So let me know what kind of things do you had. Now, I know that the ones with the super glue look pretty good. Yeah, I've seen a number of incisions that were closed up with that, and you can take a shower right away. You don't have to wait. I had to wait because I had staples and stuff. And let me show you a picture. I haven't shown you guys a picture in a while of the knee. Way back in the day, okay? So if you're squeamish, you may not want to look at this, but come on, if you're a knee patient, you should be used to this by now, all right? Let me show you a picture right here of my old incision, okay? So you can see it's all laced up. I kind of say it looks like a football. It's all laced up. And I had wondered, because it kind of sticks up a little bit, would this thing actually look anything decent after time? But yeah, it goes down. Yeah, but we do see like track marks. You do see stuff like that. Let me look at my knee here. Yeah, I don't see the little holes from the staples, but I do see the incision, and of course, my incision kind of looks a little dark right at the cuts and stuff like that. And I think that's just blood. I don't know why it doesn't dissipate. It's a little bit less now, but it's still there. So I don't think that's ever going to really go away. But I've seen some people with their incisions closed up with the super glue, and it just looked like a really small little line. So I think it looks a lot better. If your doctor, if you haven't had a knee replacement done yet, you might want to ask your doctor, how does he close the wound? Does he use the super glue thing, or does he use staples? And if you have an option, you might want to consider the super glue, because you could take a shower right away. I had to wait until the staples were out, and then some time after that too, when that thing is totally closed up, before you can actually take a shower. So yeah, it doesn't sound like much, but when you've been sweating and everything from everything, I used to break out in a sweat really bad right after the operation. And so my wife was washing towel after towel after towel, because I was just sweating it all off. So yeah, being able to shower right away is kind of a nice thing. So ask your doctor. If you haven't had it done yet, ask your doctor, how does he close up the incision? Does he use super glue, or does he use staples, or whatever? Okay. Anyways, that's all for today. Just wanted to bring it up. Let me know about your knee pain as far as the incision, and leave a comment below. All right. Anyways, I'll talk to you guys next time.